Good morning, Dan and Amy, and we've got a lot of COVID-related matters to cover, so let's get right to it. We're pleased to be joined again by Dr. Roger Klein, who's an expert with the Regulatory Transparency Project's FDA and Health Working Group. He's the former director of molecular oncology at the Cleveland Clinic and a former advisor to the FDA, CDC, we'll get back to the CDC, CMS, and HHS. Dr. Klein, thanks for joining us again. Appreciate it.
Yeah, hi, Dan. Hi, Amy. Good to be with you.
The CDC, is it a problem with Dr. Redfield not knowing how to use WordPress or upload content? Or what's the problem with the CDC such that they can make a statement about the transmission of COVID that they immediately have to retract? I mean, things are not tense enough without the CDC making such glaring errors.
Right. So I'm not sure how to explain it. I guess they said that a draft mistakenly got placed on a website, and sometimes that does happen. It's difficult to explain that and some of the other statements that have come out of CDC recently.
Like, for example, Dr. Redfield suggesting that wearing a mask is going to be more effective than a vaccine.
Yeah, I was kind of thinking of that.
Okay.
Well, I mean, is there any truth to that?
If the vaccine doesn't work, we don't have good data that masks
vaccine,
so I don't know.
Yeah.
All right, well, then what about
they may help?
No, but since you were a consultant to CDC, give us a look into the culture there, because it seems to me what's happening is you have public health professionals, including at the highest reaches, Dr. Redfield, turning into politicians.
It could be. I mean, I have to tell you, I mean, they actually have some very good, committed people there. I have a lot of friends there, and they're quite capable. And it's difficult to understand what's going on, and I don't know how to explain it myself. I really, but I'm really not sure. It's mostly career people working there, and they're good people, they're dedicated people, and they know their business.
Yeah, but they've got to stay on message. I mean, that's like the holy grail. People are turning to them. Right, that is the problem. What is their message?
Right. So I think there's a problem to some. Well, this seems like at CDC there may be some, I guess, a leadership issue. Dr. Redfield, I mean, you could only attribute his statements to himself, and I don't know him, but it makes, given his statements, it makes one wonder if there's not a leadership issue there.
All right. Well, let's talk about COVID. Does it live on surfaces? Because this is just changing every day. And if so, how long?
Yeah, so I mean, we've seen data that originally that came out and said it did, and then they said, for maybe even a day, hours. Then people said, well, you're not likely to get it that way. I suspect, in some circumstances, you can get it that way, like other viruses. I think we need to understand, this is a unique virus in some ways, but it's not without precedent. I mean, there's lots of respiratory viruses that infect us, and I think it's reasonable to assume that it can stay on surfaces, especially somebody with sneeze who has it, and you touch it. Sure, I mean, I think that's why people say don't touch your face. I think that that's the case. I mean, definitely it can exist on surfaces. It may not be the primary, and probably isn't the primary mode of contagiousness, but it still is possible.
We have another issue with CDC, and that is the turnaround time on reporting deaths, because we have so much public policy that is being made in real time by people watching the day-to-day data roll in. According to the COVID tracking project, CDC all-cause mortality tables, this graph that I'm looking at, 56% of the reported deaths each day are from 3 to 20 weeks ago. This includes the low day reports on the weekends, so weekdays are even worse. Average lag from case to death report grew from 19 days back in April to June to 45 days now.
So I don't think CDC as the repository of death reports is in the short run is probably what we want to be looking at. I don't necessarily fault it. Well, they're looking at death certificates, and death certificates are notoriously inaccurate.
Yes.
So I know they have a vetting process there, and they're trying to do it right, and that's probably accounting for some of the delay. Some of this has to do with states sending death certificates to them, so they're going to lag. And I don't.
Why is the lag time more than doubled from April to June at the height of the outbreak to now? Number one, number two, in terms of the vetting, what they promulgated at the outset is basically if it looks like COVID, it is COVID. Reported as COVID.
Yeah. So that I think that's part of the problem. I mean, as COVID, initially, if an older person died and had coronavirus, it probably played a large role in the death in most instances. But then when you start to get a broader spread into the population, you have people dying from other things, it's more challenging. How can you reconcile somebody dying in an accident, for example, who has COVID with and call that a COVID death?
Yeah, you can't.
I think there's a lot of challenges.
But
I think there's a lot of challenges to this.
Well, when the CDC came out, I think it was 3 weeks ago or 4 weeks ago, and said the actual COVID death number of people who died from COVID is about 9,000. And everybody else who passed away had 2 or 3 other comorbidities. So don't you think that's irresponsible to come out with this, now we've reached 200,000 deaths? I mean, what's the real number?
I don't think we know the real numbers. So, I've seen one person, I think, die of COVID-19. It was a 90-year-old guy who I didn't think was going to make it, whether he had COVID-19 or not, got COVID-19, and clearly that was the precipitant that caused his death. Now, you're going to see that when you're looking at a disease that affects mostly elderly people. Many elderly people have multiple conditions. It could be that event that pushes them over the edge. But I don't think we know what the real number is, because we're going to need an audit. I mean, some of these are presumed deaths from COVID. We may not be capturing all deaths from COVID. There's a lot of excess mortality, and we haven't fully discovered what that is. It's hard during the middle of an epidemic to get it exactly right, and I think it's a reasonable number, but it could be it could overstate. Hospitals get more money if a person has COVID, so certainly they have an incentive in their DRG listings to put COVID in there.
Yeah, I mean, so maybe if you had been the comms person for CDC or for the task force from the beginning, that would have been more helpful, because those sort of restrained statements like you just made are a lot better in terms of managing people's expectations and enhancing their understanding of what is known and what is unknown, and frankly, what should inform the decisions we have to make based on imperfect knowledge. That just hasn't been the case. There's just too many politicians, and it's really across the spectrum, including Trump and some members of his task force, that have spoken with moral certainty about things that they turn around and have backtracked on or watered down or completely contradicted.
I agree with you in general. I think people have been far too dogmatic about what they're saying in a situation that has been highly uncertain, and we've watched this all the way through. First, the death rate was 10 times higher than it really is. It was 1 minute it affects young people and kills them. The other minute later on we find it really doesn't. And I mean, sure, once in a while, but in general, if you're under 40, the chance of dying from it is extremely low. These are the facts that come out as the epidemic evolves, we've seen a great change in the disease itself. I mean, we get more cases, but the death tolls and the hospitalizations have gone down substantially. And so that you're right. I mean, this is the problem with being certain about making pronouncements that later turn out to be false. People lose confidence.
Well, and also running with dubious science for draconian policy. And we have this afoot again in terms of lockdowns, whether they're persisting or whether they're being argued for a renewal of lockdowns like is happening in the UK. There's a forthcoming study from Columbia University's Mailman School of Public Health and the New York City Department of Health that has not yet been peer-reviewed. It concludes that public health interventions meant to limit contact between people, such as closing schools and telling non-essential workers to stay home, quote, likely contributed to the largest reduction in transmission in the population overall, unquote. This is already being bandied about by political hacks to make the case for a renewal of lockdowns and likely contributed to the largest reduction in transmission. Yeah, right. You salt everybody away for an extended period of time and you will flatten the curve, as we were going to do for 2 weeks back at the end of March to the beginning of April. And then if you decide that you ever want to resume something resembling civilization, then that necessarily involves more risk. This is not exactly groundbreaking science, even if this peer-reviewed study checks out. Even if the study checks out when it is peer-reviewed, I should say.
Yeah, so I have a different point of view on, because this study is probably, I haven't seen it, but it's probably a modeling study. And I really, so to me, models are calculations and they're based on what you put into them. So they're, in a sense, circular reasoning. You make assumptions and then you put in numbers and you get other numbers that come out. And they're not real studies. They shouldn't be called studies. They're just kind of thought experiments. They're not, these aren't studies. And it doesn't take a genius to go look at data that's publicly available all over the place, and you can see that the places that had the most stringent lockdowns don't have the best results. They actually have the worst results.
Right.
They have the worst results in both deaths per population, if you look at them in aggregate, and in unemployment, where the economic situation is much worse. So I'm very skeptical of these pronouncements again that this is going to work. I think we need to use common sense here, and we've said this before. This is a contagious respiratory virus. Pretty much everybody seems to be acknowledging it is not going away or likely to go away until sufficient numbers of people get infected or get immune or develop immunity through a vaccine. And a group of Stanford faculty members wrote a letter criticizing Scott Atlas, and they said exactly that. And what they said was, we believe the safest way to reach immunity is through a vaccine. Well, of course it is, and everybody knows that, and nobody's advocating people run out and get it. But on the other hand, life isn't black and white, and what I think people are recognizing is that just like every other disease that we face in this world, we have to go and live with it until we're done with it. And I want to say, the Trump administration has done more than any administration that I could imagine with Operation Warp Speed to bring a vaccine to the American people. But this is a race between a very contagious respiratory virus that kills a small number of people, a small percentage of people, but infects many, and works its death through infecting lots of people, not through high individual risk. The Trump administration has done a tremendous job in bringing a vaccine to people where they have already brought up three vaccines in late stage trials. This was nobody imagined this would be possible. People thought it takes 10 years to. I was on and I said, I thought it unlikely we were going to get a vaccine in a timely way, and I was wrong. So I think what we need to do is understand that we need to live with this. We need to go on. Most people who get infected aren't going to be harmed by it. 40 to 50% of the deaths have been nursing home residents, and that when we get a vaccine, we can protect people and save lives by vaccinating those people most at risk from the disease.
Now, Miami-Dade County, fourth largest school district in the country, is going back to in-person learning. How do you feel about that? Do you think we should open up the schools?
I
for
do.
in-person learning?
I absolutely do, and I think, and it isn't because I don't think kids get it, and it's not because I don't think they spread it. I was on and I said, yeah, they're going to get it. I think it's naive not to believe they're not, and we've seen that kids are getting it and they can spread it. I'm a parent. I'm not looking to get this disease, but I also don't think crippling children and taking away their educational and social and developmental opportunities for what could take a couple year process to run its course is wise. I think it's a huge mistake. Other countries have been successful in starting schools, but I don't think we need to even go there. I think it's a common sense thing. The kids really aren't at risk from it. They face all kinds of diseases. Before we had vaccines, they got measles. And people need to go on with their lives and try to protect themselves. And we need to focus lots of attention, which we are doing, on the most vulnerable.
The Annals of Internal Medicine reported that the infection fatality rate in non-institutionalized persons under the age of 40 was 1/100%.
What?
Even people over 60, compared with 1.7% among people over 60, that's a 200-fold difference between under 40 and over 60. But still, you're not talking about high risk and low risk. You're talking about almost no risk and very low risk. That's in terms of fatality. That's what you're talking about, even when you start to go up the age demographics.
And I would suspect those are overstated because we there's 10 times. I'd have to say I haven't seen those numbers. I meant to look at this, but this is we have many more infections than we have cases, and so to the extent that, for example, we probably got at least 70 million infections already in the United States. So if you would just look on an aggregate basis at the infection fatality rate, you'd call it 29 out of or 0.29%, or you'd call it 2 out of 1,000 to 3 out of 1,000. On the population basis.
So just since you mentioned that, and the perception that about 20, it was among those suggesting we were nearing herd immunity, that about 20% seroprevalence, and you start to see deaths sharply decline and transmission sharply decline, that happened in Sweden, London, and New York. But now there's been a bit of a partial second wave. Deaths still down, transmissions up a little bit. What does that tell you about herd immunity or no herd immunity, or what we're tracking for?
Well, I don't think. First of all, the problem with the serology test is the antibody levels can drop, and so you could have been infected, and so then you might get false negatives from the. You can get false positives too, but I think there's a risk that antibody titers drop below the level of detection of the test. I think that the immunity to this disease could be more complicated or complex than we understand, because we have coronaviruses that circulate in the population regularly as respiratory viruses, upper respiratory tract infections, colds, and so to the extent that people have been exposed to those, they may have some residual immunity that cross-reacts. I think immunity isn't an all or nothing phenomenon. People look at antibodies. Well, it's not just antibodies. There's a whole immune response involving what are called T cells, what are called B cells, and you get these memory cells that respond to proteins that are foreign, and that's what a virus basically produces, foreign proteins, and they can react to proteins that are similar looking. So could it be, for example, that people who have been exposed recently, at least, to cold viruses, like children, where they always have a cold. Maybe one of the reasons they tend to get less infected is because they have some cross immunity. What about in Asia? Maybe in Asia they've been exposed to something on a wider basis similar to what's going on now, and how's that impacting the population spread? I don't think we really understand it yet, but what we do see is once we start to reach a level of infection that appears to be lower, much lower than you would expect for what people are calling, population immunity or herd immunity, the infection rate really does seem to slow down. I think we're seeing that, And, part of it is probably behavioral. People are staying out of crowds, and certainly vulnerable people are protecting themselves. But I think that there is a possibility that we don't need to reach these 70% levels that people are talking about, because there are certain people who are simply not as likely to get infected.
He is Dr. Roger Klein, expert with the Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, former advisor to the FDA, CDC, CMS, and HHS. Dr. Klein, thanks again for joining us.
Thank you.
And he joined us on our turnkey.pro answer line. Coming up on Chicago's Morning Answer, Stephen Moore joins us. And later, new charges against the Dreadhead Cowboy. But now let's head into the newsroom. Here is Mike Scott.
Skies are clear. We have 60 degrees at 7:30 on AM 560, The Answer. And the Eiffel Tower has been evacuated this morning. The surrounding area closed off. Paris police investigating a bomb threat. The late Justice Ruth Bader Ginsburg will lie in repose at the U.S. Supreme Court. Public viewing will be held from 11 a.m. until 10 p.m. today and tomorrow. Vice President Mike Pence is promising the seat left vacant by the death of Ruth Bader Ginsburg will be filled.
We're going to fill that seat.
Right. Pence rallying supporters in New Hampshire yesterday, while Democrat vice presidential nominee Kamala Harris is discussing racial disparities at a barbershop roundtable in Michigan.
It made worse what was bad to start with, in terms of who was getting resources, who was having access to resources or not.
The California senator near Detroit yesterday saying black businesses have been disproportionately impacted by the economic toll of coronavirus. A lot more Americans want to buy homes. The Mortgage Bankers Association reports demand for loans to buy homes is 25% higher than a year ago. A teenage boy rescued from a fire late last night at a home in Lisle